Just stay tuned, call somebody, let them know that we're on the air. This will be streamed, as well as we will be doing this repeatedly on the UCOM and Unity TV broadcast. I would like to give a special thank you to Dr. Eric Fales, who put all of this in motion. He worked real fast. I contacted him on Friday, and he had me in contact with Dr. Reyes on Saturday, and today is Sunday, and Dr. Reyes is here. We want to thank each one at Baptist Hospital. We want to thank our healthcare physicians, our nurses, everybody that is putting your life online to save us, to work through this coronavirus. So we thank you for tuning in. We now turn you in the hands of Dr. Reyes.
Thank you, Dr. Jones, for inviting me, and thank you to Greater Grace Victorious Assembly for giving us the channel to reach out to our community in Montgomery and in Alabama. These are unprecedented times. As Dr. Jones mentioned, I'm an infectious diseases specialist here in the community, and I came today to share what I know and what we are practicing at this moment. I just want to mention that it's 11 a.m. On Sunday, March the 29th. The knowledge and the practice of this infection changes constantly. So if you are seeing it later, there may be something that may have changed in practice. Science does not change. Practices, sometimes we have to change. So let's go to the technical piece of coronavirus. The coronavirus 19, which is the disease, or the SARS coronavirus 2, it is a new virus that started in Asia, in the city of Wuhan, in China, in the last week of December. Despite all the efforts of the Chinese government to try to seclude that city, unfortunately, that virus traveled fast, and it's been infecting cities after cities. It has gone through ships, planes, trains, cars to other cities, and it's been infected. And I'm pretty sure that you have been following the national news and the world news. This infection is real. This infection is killing people, and this infection is in the United States. This infection is in Alabama, and this infection is in Montgomery, in our community. This virus, so far, what we know is that transmit from person to person. It transmits by droplet, which is little pieces of saliva when we speak, when we cough, and when we sneeze. Those droplets, if the person is infected, can reach either another person, the mucosa, meaning the mouth, the nose, or the eyes of another person, and infect it. It can also reach to surfaces. That's the fomite or contact piece. So we have to be extremely careful when we approach other people and when we touch other surfaces. You can observe me as a trained person, how much I will try to avoid touching my face, and at some point I will fail because it is an unconscious movement. We need to change the way we behave. We need to change the way we greet people. So one of the more important lessons that we need to learn is the importance of social distancing. Usually, if a person is sick and does not cover their cough, those droplets that I talk about will travel 3 to 4 or 4.5 feet. If we keep at this, that's why you will hear from every agency that it is extremely important to be 6 feet apart. Without any type of protective gear, we should be able to avoid getting infected from a person that is infected by keeping that social distancing. That is our first mechanism of defense. It is extremely important. So if we keep social distancing, that will be our first barrier of not getting infected. It's extremely difficult to maintain 6 feet of social distancing if we are working, if we are, in an office. Not only that, that is for the droplet piece, for the air piece. But what about the fomites, the contact? Somebody will be sick, leaning on this podium, coughing, and another person will come, touch it, and take the hands toward the mucosas, the nose or the eyes. And that's how it will be transmitted by fomites. So we have talked about 3 things: social distancing, 6 feet, which is about 2 meters. We have talked about covering the cough, or if somebody is coughing, always need to have a mask. We have talked about touching surfaces. And as important as those 2 or 3 lessons is washing our hands. We are not used to wash our hands after we touch surfaces. We are not. We need to retrain our brains to, instead of shaking hands, keep the distance and wave. That's why it's so important that non-essential businesses or gatherings stop. The infection is currently in Montgomery, Alabama. We have about 21 or 22 cases in our community, spread in different places of the community. Of course, those 22 cases that I'm talking are already confirmed, but there are others that we are pending results. We have results pending from March the 24th, March the 23rd. It's been 6 days. Unfortunately, the labs are so backed up that we cannot have that data in a timely manner to identify the other ones that are outside. Of course, everybody that has been tested has been recommended to go home and stay in their houses, place a mask, or cover their cough, because if they do not do that, they will be transferring the disease to another person. It is extremely important that we keep social distancing. It is extremely important that we wash our hands. I have waited until this moment. I know my wife is seeing. I love you, and I'm taking this just for safety. I never take it out. But since I have to wash my hands, I cannot keep this in my hand. Remind me, please, that I put it there. I love this watch that I bought for my son. It has my initials and his initials. I cannot use it anymore. So this goes to my pocket starting today. Because at the time that we wash our hands, if we have jewelry, we will be able to get the infection from our hands when we use water and soap for 20 seconds at least, but not from these surfaces. So it's better that we don't use them in our hands. So washing our hands is extremely important. When we touch surfaces, more plastic and metallic, we do not know the exact science of for how long the virus can transmit when it's present. You will read a lot saying that the virus can stay for 72 hours or 24 hours or 36 hours, but we don't really know that even if it is there, if that means transmission. But we're not gonna play with that. It's better that we try to avoid mobilizing with our hands and use other parts of our body. Cloth does not transmit as much as hands and the surfaces that I mentioned. So extremely important that we keep social distancing. We wash our hands with water and soap. I had some questions from the community, from this community, if it matters if it is antibacterial or non-antibacterial. It really doesn't matter as long as you have soap and you wash your hands for at least for 20 seconds, cleaning nails and in between the fingers, the wrist, with water and soap. That is extremely important because I touch this, then I touch my nose, I touch my eyes, I'm tired, I clean my mouth, and we can infect ourselves by touching something that somebody else has coughed, even if they cover something got into the. Do not share personals. You should stay as much as home as possible and only go outside for essentials. We need to eat, right? We need to go get some groceries. I have to pump gas, but I have to retrain my brain whenever I grab that hose that I'm gonna wash my hands. If you do not have water and soap immediately after you touch something that is publicly touched, well, alcohol at 60%, those sanitizers will be a second good option. The importance of the distance, the washing our hands, this is what it will actually get us out of this pandemic. Because if we do not get within those 6 feet, there is no infection. If we wash our hands, if we stay at home, the problem is not in the hospitals. Everybody think that the problem is in the hospitals. The problem is not in the hospitals. The problem is in the community. The problem is outside. That's where the problem is. Because in the hospital, I can make rules and needs to be followed inside of the roof of the hospital. But outside, we don't. So we need to be extremely, extremely judicious with what we do. Why is that we go out? Who comes to our house? This is not extra vacation. This should be a pseudo quarantine state. There are other places that have already put in placement quarantine state. That is not implemented in Montgomery, Alabama. I am so grateful to the mayor by putting a curfew. I am grateful to Governor Ivey by closing the non-essential businesses. I am grateful that for the steps that our authorities have given so far, but there is still more. There is still more that we can do for our community. We need to stay home as much as possible. Only come out for essentials. Here, the facilities, the educational facilities of our community have been closed on March 18, and the non-essentials also on March 18. There is no travel limitations, but I think that will help. I talked to my brother this morning. He lives in Lima, in Peru. That's where I was born, but my home is this city now for the last 7 years. He was telling me that the borders of the country are closed. You cannot get in, you cannot get out. They cannot get out of the house unless he's going to the grocery store and going in packs of 1. Lima is a city of 10 million people, so it's kind of a New York. They have to use masks and keep social distancing. If you drive, your license are taken from you. This is my own brother telling me these things. I think that Alabama and Montgomery and our towns and cities around us have the perfect geography for us to succeed in this pandemic. We are here in this beautiful church, and we have a space to keep 6 feet apart, and there are 15 people here, but everybody's apart, 6 feet or more in some cases. We need to keep social distancing. We need to wash our hands. We need to protect our people. One of the questions that I had in the email that I got from this church community was, for how long is this going to last? There is already data from the healthdata.org that show us how long this is going to last for us in Alabama, for the measurements that are in place today. Of course, the more measurements we have, different the curve is. This type of pandemics go, if you see in number of cases in the y-axis and time in the x-axis, it goes like in a bell shape. It goes exponential at the beginning, it flats at the top in the number of cases, and then it goes down on time. China is in the way down, for example, after 3 months. It is predicted, with my own readings, I thought that the peak will be on May 1st. Today, with the data of today, the peak of the number of cases will be April 24th. This is, you all can get that data on COVID-19 healthdata.org, and you will see those projections. So we should have about 3,500 cases by then, 3,500 cases. So far, we have diagnosed 791 cases. We have 9 deaths in Alabama. I'm talking about Alabama. And the numbers that I gave on 3,500 is Alabama. We have 9 deaths in Alabama. It should take only 1 for us to be responsible. 1. Because that 1 person could be our parents, our husbands or wives, our brothers, our children, our neighbor, our community member. It should take only 1 for us to be responsible. We have 9 deaths. To me, for me, it's easy to understand this process. My brother was telling me, Carlos, we have no defenses against this. Oh, we do. I just told you. Wash your hands, stay away, and stay home. You will be fine. And even if you get the disease, it is mild in about 80% of the population. But again, there will be those 9 people that so far we have lost. We have been only able to diagnose 791 because I just told you, the test is backed up 6 days ago. So we will be, once we get the dates or the results for the test as of today, we will be double or more. So this is serious. We have tons of cases in the community now. Widespread should be happening in the next 2 or 3 days, unless we take actions, unless we protect our community, our houses, our businesses. Everybody is losing money. Everybody. There's no one person that is not losing money on this. Everybody is. But we will be able to recover somehow if we preserve our community, if we preserve our brothers and sisters, our parents, our children, the future of Alabama, the future of Montgomery. Social distancing, washing your hands, waving, not touching. There is the prediction on that peak day, it is of 37 deaths for that April the 24th. So far, there are 9. The prediction says 37. Who is going to be? Me, my wife, you. Who is going to be? The only way that we can avoid that is by keeping social distancing, by staying home, by washing our hands. If we are sick, even if it is a cold, to cover with a mask, because you don't know, you cannot recognize it. Some people have a mild case with a little cough. Some people have a very difficult clinical course that will end up in the ICU in a ventilator. Not only that, in this document, it clearly says the beds needed for Alabama, 3628 beds. The beds available, 5743. So looks like Alabama has enough beds to hold whoever gets sick. regular beds. But the ICU beds, the intensive care units beds, we are supposed to need 553 beds. We have 474. So we're short 79 ICU beds. I have talked to colleagues in Lee County, and they are trying to recreate ICU beds because they don't have enough. I have talked to other colleagues in other counties, and they are in the same situation. We can do what we need to fight this pandemic, and is to keep social distancing, quarantine at home, wash your hands, retrain your brain on how you act around people. And I'm going to repeat, the peak day for Alabama under the current circumstances and limitations is April the 24th. If we change our behavior,
to Pastor Jerry Davis and his lovely wife, Mother Davis, for opening the doors to come in and brief us, to bring the doctor here to brief us about this virus. It's very important. There are so many people that is living in fear. There are so many people that really don't know what to do. But, you know, for our doctor to come out and enlighten us, we do thank him. And those of you that is tuning in, we encourage you to just continue to watch, because we will show this in its entirety. I think we have about 3 shows by way of broadcast. We will do back-to-back episodes of this. We thank Greater Grace Media Team, amen, for streaming, for everything that they are doing to get the news out. We thank you all. Thank God for UCOM in Unity. We thank you, our editor, each one that is going to bring this out to our community. Getting ready to go into about 50 million homes, and I think that we will be ready to get this out there in the very near future. So we thank you again, Doctor. Thank God for Baptist Hospital for the care that they gave to my mother, who by way I met Dr. Eric by phone, and Dr. We thank you for being with us. So until next time, may God bless you, may God be with you, and as we always say, put God first, and remember, God did not give us the spirit of fear, but he gave us power, love, and a sound mind, and that's what it's going to take during this time. It's going to take that sound mind. Thank you, and God bless you.